Track down the fake Percocet pill that's led to the highest number of concentrated overdoses in state history.
4 people have died. There are many more right now still in critical condition. Now, this story happens as new data reveals drug overdoses are now the leading cause of death for Americans under the age of 50. Dr. Mandira Mehra with SSM Health is here this morning with more. Good to see you.
Good to see you. Good morning.
So we mentioned more overdoses than deaths by gun violence, more than car crashes, more than suicide.
Cancers, heart attacks.
Yeah, I don't mean to minimize any of those tragedies, but that number out from the New York Times is just striking.
Absolutely. It does show us this is a modern day epidemic or plague, as some people are calling it. So the leading cause under 50 now is opiate prescriptions, not necessarily legal, illegal, just opiate prescriptions and overdoses. This is definitely a crisis. This Georgia example is a fantastic example of a situation where something was designed for a medical intent, really designed to help people feel better, but now has a huge abuse potential, and unfortunately does cause overdoses, respiratory depression, and a myriad of other symptoms.
Scary stuff all the way, right? I mean, and are we even talking about this enough, do you feel?
You know, what's interesting is every time I think it comes up in the media, it gives us a great opportunity to sort of raise awareness, cry out to public health officials and medical officials and scientific officials and say, what can we do better? How do we really tackle this problem? So many people are looking at where this problem begins. Does it begin at a younger age, an older age? Unfortunately, it's a combination of factors. You know, this is very connected to carfentanil that we talked about a few weeks ago, and fentanyl and heroin. And as prescription drug usage goes down, maybe heroin usage goes up. And so these are so many combined factors that all tie in together.
So in talking with a former law enforcement official recently, Dr. Mehra, we were talking about the Tiger Woods incident and how we saw video of him obviously disoriented in a police holding cell. He said the media missed an opportunity to talk about something different than just Tiger Woods. And I know you wanted to kind of touch on that as well.
Absolutely. The Tiger Woods example is a great example of a DUI. We often think of a DUI as pretty much just alcohol related. Very quickly now, prescription drug medication is becoming the #1 cause of DUI, or driving under the influence. And so those little warnings on the bottle and the warning that your doctor gives you are so important here. I mean, this is a example, unfortunately, of not just a celebrity, but a sports legend that is suffering and has had, I think, 4 back surgeries in the past couple of years, is still in pain. And so many Americans are in that same boat, either post-operatively or chronic pain conditions, and they take pain medications. Unfortunately, you should not be operating heavy machinery. You should not be behind the wheel. This is a great opportunity to turn sort of a negative situation into a positive, that we should really take this moment to really raise awareness and say, talk to your health provider, talk to your doctor, say, is it safe for me to be operating a vehicle, heavy machinery, so on and so forth? Those labels are there for a reason.
Learning opportunities.
I'm glad that Tiger Woods is safe and okay, but this is just an opportunity where tomorrow, unfortunately, we'll probably report a story of someone was injured or someone was hurt. So it is preventable.
Got to be careful.
Yeah.
Dr. Mehra, good to see you again.
Nice to see you.
Thank you.
Thank you so much.